Hi, I'm Ed Briggs. I'm the Director of Health for the town of Ridgefield. And I guess I'm going to talk a little bit today about what happened with the COVID pandemic experience. It started for us back in March when we ended up having our first positive case and also our first positive death that was in one of the assisted living centers in Ridgefield. From there, we went on to contact tracing any people that started showing up positive. We did contact tracing, calling them up, finding out who they were exposed to, who they exposed, what their symptoms were, um, when they first started getting their symptoms. So that took a lot of time. And then we ended up having them self quarantine for a period of 14 days. Um, from there started to be so many people throughout the state. The state recommended that we stop the contact tracing for a while because they figured so many people were exposed that it wasn't worth the time. Now they're starting to go back to contact tracing, so there isn't a spike again. Um, but it got interesting for a while. Working with our police chief, our emergency manager, um, Rudy Marconi, our fire chief, we were having town hall meetings that were basically Zoom based 3 times a week to keep the public informed. We had newspaper articles out. Our PIO team was putting a lot of press releases out and Everbridge releases to keep the public informed. And it was tough for a while because all the data started changing, all the recommendations started changing. Should you wear a mask? Shouldn't you wear a mask? How beneficial is it? Are there medications available for prophylaxis that are effective? And different kind of medications were available, and there were differing opinions on that. So that made life interesting too. And then there was a lot of confusion about testing, where they could get tested, the type of tests that were available, whether or not they needed a doctor's script in order to get tested. So there was a lot of confusion and miscommunications with the state, let's put it that way, as to the appropriate way to handle a lot of things. As things progressed, we also got into problems with delivery of personal protective equipment and shortage of personal protective equipment for the healthcare providers, for the health departments, for the restaurants that were remaining open, things like the Ridgefield VNA. It became challenging to try to get effective personal protective equipment for us. Right now, we're trying to work on another version of contact tracing for the remaining cases that are popping up, so we can try to prevent a spike from happening again. So if somebody does appear to be positive, we would go in and follow all the people who they were exposed to and who they may have exposed, so we can keep the diseases on the amount of diseases under control. Right now, we're in the process of phase two. There's 4 phases for reopening. We're in phase two. Um, the restaurants and general stores opened in May with limited um, seating or basically takeout and outdoor seating taking effect. And now they're moving into indoor seating at 50% capacity. The hair salons opened up a couple weeks ago, and now the nail salons and other tattoo parlors, other customer services, personal services will begin to open, as well as movie theaters on a limited capacity, limited outdoor events, and 50% capacity on the restaurants of what their usual limit is. And then later on, probably in July, the rest of the stuff that we didn't cover will begin to open up. And that's basically it.